Hello and welcome to webinar series from myself Shanti, and today's topic for discussion is all about the newborn fever. Yeah, for this discussion I now invite our expertise, none other Dr. Satya Priya Savugaru, who is our consultant neonatologist pediatrician from Yashoda Hospitals, Malakpet. I welcome you, sir, and we all are privileged to have you with us today. Yes, sir.
Hello everyone. I'm Dr. Satyapriya Sahu. I'm delighted to join this session. This is a very interesting session about the newborn fever. Thank you, everyone.
And I now request all the speakers to introduce themselves. Yes, over to you, Shesha.
Hello, good afternoon, sir. Good afternoon, ma'am. Myself, Mr. Sesh Kumar, currently working as staff nurse at PHC Ramapuram, Annamay district, Andhra Pradesh. I'm very thankful and grateful to be a part of this webinar, which is in need of this community currently. Thank you.
Thank you, Shesha. Yes. Yes, now let us introduce our fresher nurse who is Aditya. Yes, Aditya.
Yeah, good afternoon, ma'am. Good afternoon, sir. Good afternoon, everyone. So, myself, Aditya Pragashan, I am staff nurse. I'm working in pediatric. So, I'm very excited to be here because this is my first time, first attempt. So, I think it will be very nice and it will be a great thing. Okay. So, thank you, everyone.
Yeah. So yes, going forward, we will be just keeping this session very time bound because it is going to be very simple way of understanding and learning. Yes. So my first, query or insight, I would like to, start with the sir's opinion on what is actually this newborn fever means and how common is this condition, sir? Over to you for your insight. Yes.
So newborn fever is defined as any temperature above 38 degrees centigrade or 100.4 degrees Fahrenheit. Yes. So these are the fever is generally it's not always a fever actually. It may be a hyperthermia as well. But the hyperthermia is more than 37.5 degrees centigrade. All the hyperthermia are not fever. Yes. So the fever can be fever can be due to the hyperthermia, but all the hyperthermia shouldn't be treated as a fever. So we have to see, and if we will see about the common how common it is, the fever is around 10 to 14 babies in 1,000 term babies they get fever. Yes. Among that 14 babies, around 10% of babies will be having some invasive bacterial infections. That is called sepsis in our term. Again, sepsis is divided into two parts: early onset sepsis, late onset sepsis.
Late onset, yes. So yes, as you rightly said, all hyperthermias are not fever. Yes. So going forward, let us see what our speakers wish to understand from our expertise, Dr. Satyabra Sahu. Yes, Seshu, over to you.
I would like to ask you a question. Yes, sir. I would like to ask you a question regarding what are the common causes and risk factors for newborn fever?
So the common causes of fever, again, I will...
yes.
Okay. So there are two causes actually: infectious causes, non-infectious causes. Infectious causes, again, bacterial, viral, fungal, that again divided into two parts: early onset sepsis. If the infection is coming within 72 hours of life, that is early onset sepsis, or if it is coming more than 72 hours of life, that is late onset sepsis. So again, that is a different horizon completely altogether. I will talk about the early onset sepsis, do B streptococcus, E. coli, the Klebsiella, those, we all encounter these bacteria. Late onset sepsis, Staphylococcus aureus, Enterococcus, fungal, so that they will come into picture. But again, I'm saying it, this is only 10%. The 90% is the non-infectious causes: dehydration, lack of proper feeding, extreme climates. The parents or the mother doesn't know how to keep the baby, overwrapping of the babies, excessive clothing, and all that will lead to excess temperature actually. So these are the infectious and non-infectious causes of the fever.
So
and again,
thank you, sir.
Yeah.
I do have a small query from my side. So sometimes, especially at the community or field level, some mothers may unknowingly wrap with more cloths knowingly or unknowingly, if the baby's temperature superficially raised means, do we consider it as a newborn fever?
Yeah, that is very good question actually. Listen, when you touch the trunk or head, if it is warm,
Yes.
it is not fever. You have to check the temperature, right? First, you have to check both the things, head and trunk once, then the peripheries, like this hand or the foot. You have to see what is the temperature difference. If there is a constant temperature in both the sides, like if the foot and the hand shows the normal like equal temperature as the body, then that is not fever. In fever, in an infective causes, there is a core to periphery temperature difference. That means the temperature, for example, my body is having a temperature of 38.5 or 39 degrees centigrade, but my foot that is showing some 34 degrees centigrade. There is a huge temperature difference. That means if the difference is more than 3 degrees centigrade or more than 2.5 degrees centigrade, that is a picture of infection. So that is proper fever. Okay. If the constant temperature is there throughout the body, that is a hyperthermia. Again, I will emphasize that you have to remove the all the wrapping, clothing.
Yes.
You have to check the temperature after 1 hour. Then again recheck.
Yes. So here I would like to, understand from your point of view, like, does this newborn fever mostly, I mean, the premature and low birth babies are more prone for this, if at all it is not a, as you said, bacterial infections and non, infectious conditions are, yes. Yeah. Yes, Aditya, it is your understanding, yes.
Yeah. So, my question is this, like, how should a mother check her baby's temperature at home? Like, some mothers will check after the bath, so it will be baby already little bit cold, no? So unnecessary that time mothers are checking means it will be like false temperature, no? So many things are there, no? Like bathing or cool temperature. So what all guides we will give for the mothers, like.
Exactly. If the slide is mentioning everything, every mother is a doctor. This is a fact actually. The mother knows the best about his baby. So when the mother touches the, baby, many parents are coming that doctors, my forehead is, my baby's forehead is warm and the baby is having fever. But that is no fever. You have to measure the temperature. There is a proper protocol you are having. So we have having some thermometers actually. So mercury thermometer, digital thermometers. For the baby, the best is a digital thermometer. You have to place in a proper manner in the axilla, and that bulb should completely touch the center of the axilla, and you have to measure till you are getting a beep sound. So a mother should, every mother at the periphery level, at the central level, you have to see you have to monitor the temperature with a digital thermometer. That's the first. But the primary thing the mother should do is she has to check the head and trunk along with the foot. If there is a difference, so she has to rush the hospital, because any fever is a matter of concern. Be it hyperthermia, be it infective causes, you have to rule out infection first.
Okay, sir. So like,
yeah.
If we are checking in home means in ICUs means we are already connected to the thermal probe. So we will not add any +1 or like -1 or nothing we will do. So in home we should do that.
You mean to say adding, adding on,
adding.
one digit, yes.
Yeah, actually, the best rule for the thermometer is, if you are adding, that is a typical oral temperature.
Okay.
Even if you are not adding, for example, the normal temperature, if we are saying that more than 99.5 Fahrenheit is a fever, and we are adding extra 1 for the oral temperature. So we have to tell them, if you are putting in the axilla, better to add. But again, the mother should be trained by if the mother is staying in the periphery CHC or PSC level, or at a corporate level, or in this city, they have to visit the doctor. At least they should be knowing, because 99 or 98 Fahrenheit is not a fever.
Yes.
She must know that what the fever is, what is the difference in fever. Because some parents are telling that, sir, my baby is having 97 degrees Fahrenheit and she is having fever. That is not a fever, madam. So these are the things the training, those patients were coming to us, or they are in the hospital premises.
Yes.
The sisters should train them.
Yes. So yes, you very greatly you have provided a few of the tips, like how one should check the temperature by using the digital thermometer, and should we also look for a few red flags, like maybe the baby has one or two episode of fever, and mother is just waiting, maybe not in a sound mind to take the decision. So what all the other red flags she should look into, like we also have seen baby since the morning baby was doing well, the behavior of babies suddenly change. The baby's skin is warm, as you said, irritability, crying, mother is not able to console. Are this to be considered as red flags, or something monitoring signs which where
Yeah,
mother should seek medical attention?
yeah. Along with the warm skin,
Yes.
this typical infective fever, those red flags I will describe one by one.
Yes.
First, the baby will be very dull. There's a dull activity. 2 days
Yes.
back, there is very active, moving his own hands and legs. All of a sudden, the baby will get some very dull. No feeding at all. Feed intolerance would be there. The baby, if the baby is sucking the breast and all, the baby will vomit it out everything. Okay. So dull activity, lethargy,
Yes.
poor feeding, feed intolerances, and if there is core to periphery temperature difference, the mother should feel that the feet is very cold, but the trunk and body is warm. So there is a huge difference. That means the baby needs. And one more thing, if the baby is having abnormal movements in the form of seizure, if the baby is having abnormal movement, seizure, and also baby is having breathing difficulty. For example, the baby is having pneumonia, suppose. So they will get some, difficulty breathing. They will have retractions. The breathing rate around more than 60. Since the parents are very educated here, they can count, giving us stoppers there. 1 minute how the rate is there. So if it is more than 60, it is a typical tachypnea, and that is a sign of pneumonia only. So these are the red flag sign they have to see.
Yes. Yes, very productive insight for the same. And yes, going forward now, yes. So should a short duration fever in a newborn be considered a false fever? Like as Sheshu was mentioning, how should one understand and consider? How should once the mother understands that yes, baby is suffering with fever, and how she should transport or cover the baby, or like most of the families, they have a mean of a two-wheeler, they come to the hospital. So still the baby should be covered, because I'm sure the baby will be also feeling cold in a, outside weather. Yes, sir. Over to you.
Again, sir, babies, those who are very preterms, very low birth weight, they don't have that typical immune response to get a fever.
Yes, I think
Term
there's
babies,
a
the weights more than 3.5 kg, they get fever, sir. One more thing I just want to emphasize, that a short duration fever, if it is there, it is more important actually. You have to check the temperature once. You have to rush to the hospital, because any duration of fever is a matter of concern. You have to rule out some infections before telling this is just a hyperthermia, nothing to worry.
Yes, Aditya and Cheshu, do you have any of your, doubt in your mind to be cleared up right now? Yes.
Yes, ma'am, I do have a small query. So as Sar said, the mercury thermometers and all, etc. Nowadays, the people are, the hospital settings are not using that. So advancedly, they have digital. Moreover, that the forehead gunshot temperature thermometers are available. Would you recommend the gunshot thermometers, sir, for exact temperature assessments?
No, actually,
will they give accurate
so
temperature?
They give a very false readings in the newborns. In the adults also they give the false readings. So we generally recommend only the best is always the rectal, but we don't recommend rectal thermometers for the newborns or preterm babies or anyone. So the digital thermometer is easily accessible and easy to use for the parents also, for the hospital premises also. So best to use is the auxiliary one, and should be digital only. So no mercury.
Yes. Yes. Yes,
Yes,
still
sir.
we
Thank
see,
you.
in the theory, and in the Google or any website, they always focus on the rectal temperature. I think the rectal temperature, it should be in the hospital premises with the guidance, because they may injure, the rectal, the newborn, if at all they do not know the right set of insertion of rectal temperature. Yes. So
Um,
yes. Yes, Shishu, is
yes,
this
sir.
your,
Uh, uh,
yeah.
Sir, what recommendations, the medication and feeding precautions should a mother follow for her newborn if the baby is suffering with fever? You recommend, sir?
So, sir, here more precisely, I would like to add on. Like now, the baby has come to you, and you have just given few, analgesic antibiotic drops to the mother, and you educated her with this
Yeah.
frequently interval. So, what is the education we should give to the nurses for, to educate the mother? Because
So this is
yes,
for all the all the people who are watching this show, and
yes,
for the sisters and the parents. Fever shouldn't be treated unless until you know this is a fever. If you recheck the temperature after 1 hour, if it's still persisting, even after unwrapping the baby, even you will check the room temperature and everything is good, but still the baby is having fever, then only treat with a proper, like the thing should be a proper dosage, and that is a paracetamol, and you can't just give, like just watch some show and watch a chat GPT and
self-prescribing.
as per the
Yes,
dose. Please,
yes,
you have to follow some protocols. You have to give in a proper dosage, that is the 15 milligram per kg per dose, and you have to give maximum 4 times a day. But we generally, personally, I recommend only SOS. If the baby is having temperature of more than 99.5 degree Fahrenheit, you have to give them paracetamol, that is 15 milligram per kg oral. But if you're using for the IV, then 10 milligram per kg per dose.
So particularly, this is all based on baby's weight, not the age, you mean to say, sir?
Yes, this is for the weight only. This is not about the
Weight.
age. Yes, yes.
Yes.
If the weight is around 3 kg or 3.5 kg, we have to give 0.5 ml, like
Yes.
0.5 ml. So this is
Yes.
what? 15.5 milligrams, sorry. 15 to 0.3,
Yes.
that is, I think 15 milligram per kg, that is 45 milligram.
Yes. So it depends with the full term, the dosages are different with, low birth weight babies are also, it is different. Yes. Yes, Aditya, your concern about the same.
Ma'am, if we are not practicing a good hygiene, like during the breastfeeding time or any interaction with child time, so what will be the, like, mothers are not aware of that? No, those people won't do the proper hand wash, and if it is giving breastfeeding means they are not cleaning the breast properly. So many mothers, like illiterate peoples, are this, no, so they are not aware about like that. So what we will advise more, like,
So you
To the
mean to say
mothers.
the hygiene
yeah,
while, babies, having the breast milk and other environmental and seasonal triggers, you mean to say?
yes, yes,
Yes, sir. Over to you, sir, for your insight. Yeah.
So the triggers, if you are saying for the, how to, the fever, some triggers causing the fever or hyperthermia. Again, I will tell you, this may be a seasonal, some the extreme temperatures. This may be a
Yes.
cultural only. Some people are, they are wrapping the babies like, 3 to 4 layers, even if they're in the summer.
Yes.
And again, some parents, they, they choose to be in a, some parents, like some families, a nuclear family, some are a joint family. They completely stay in a single house, in a single room with 4 to 5 members. Maybe one of them is sick, having some cold, cough, some viral infection, and they are not using a proper protocol. They are not using any alcohol-based hand rubs and all.
Yes.
Again, they don't, follow that typical hand hygiene before, touching a newborn babies. So those babies are very prone for the infection. And these are the
Infection.
triggers: overcrowding,
Yes.
exposure to
Yes.
the sick people, extreme of temperatures and all.
Yes.
So best is to, just avoid infection by using at least alcohol-based hand rubs or
Yeah.
maintaining a hand hygiene.
Yes.
and
Yes.
also like mothers, like will be giving any like self treatment to the babies, no, sir. So even my mother also, during my childhood, if I get fever means she will give paracetamol, and if it is not at all reducing means again we will go to doctor. So while consulted time I have no fever, then doctor will be like, oh, it is a minimal fever, don't worry, like that, and doctors also will send. So there will be a miscommunication between like patient
So,
and
yeah, I'll just precisely quote this insight, what
yeah.
you wish to understand. Yes, in Indian scenarios, sir, like a lot of the mothers, like maybe one or two visit they have come to you. After that, they know what they are supposed to do with that paracetamol drops, and they start, treating by themselves, self prescription. Like, and we know in India, any prescription drugs we can just buy. It is not like over the counter, no medications available, and then we see the baby land up in a lot of problems, like as you were talking about,
It will be
early
end up in
symptoms of
chronic.
sepsis and delayed sepsis. Yes. So you see a lot of mothers who comes to you, sir. What is your, like, what is the mindset of the mothers, like in the Indian
The people,
population, sir?
very good question actually. Some parents, they do come. They have come to me. I have prescribed some paracetamol, something else, and they have their own, they have their own ways to treat their child, because the elder, they have given some brufen, like ibuprofen. That is a
Yes.
different thing. For the newborns also, they have given the brufen only. With asking the internet and chat GPT, they have given a ibuprofen to the
Yes,
newborns.
yes,
So that is absolutely contraindicated in to use in the newborns, but they have given it.
yes.
So my thing is, if you have really in the concern for your babies, please visit your nearest doctor. You can come, let the doctor examine whether the baby is having real infection or not, if it is a fever or not. Then the
Yes.
doctor will advise you
Yes.
the medication for that. So don't use that internet to use this against your baby. I am telling you, against your baby. This is not for your baby. This is against your
Yes.
baby.
Yes.
So try to be more smart, and at least visit your doctor, nearest doctor, for the
Yes.
treatment of fever.
Yes. So yes, Sheshu, do you? I'm into like just like adding on, like what kind of hospital infection control practices you have, witnessed in your facility. If at all you have worked any time in the, ICU setup. If at all you are aware of
Yes, ma'am.
this, or you want to ask something
Yeah.
from sir. Yes.
Actually, at NICU or PIC levels, the hand hygiene and hand rub is more important. So I want to talk about the field level. So most of the time, sometimes the hand rubs may be not available, and we may not have facility to do hand washing and all, at especially in government setups. Yes, nowadays most of the government hospitals are well equipped with the hand washing facilities also, but the
Yes.
nurses who are having a lot of work may not have time to perform, but it's mandatory. I would like to ask sir, the infection control practices, what we have to exactly practice to control and prevent all these type of fevers, etc.
So yes,
The
I
best
think
thing is,
before.
again, he has answered
Yes.
everything actually. The hand hygiene is the
Yes.
best thing. So if this is not available, alcohol-based hand rubs, you have to again follow the same, the primary school hand washing at least. We don't have the hand washing facility somewhere, because when we are touching one baby, then again going to the other baby, again going to the other baby. So that time we don't have the time to wash your hand properly. So that is the reason we are using the alcohol-based hand rubs. So after seeing one baby or patient, you just use that alcohol-based hand rubs again. Just at least CDC is recommending 20 to 30 seconds at least. The hand rub should be
Yes.
there. So you have to take that amount of that liquid in your in the palm, and just rub it like you
Yes.
do for the hand washing. Then you go to the
Yes.
next baby first. Then protocols should be a proper for the every NICU. All the units have a different protocols, but the rule is the same to prevent the infection. First, there shouldn't be any overcrowding. The space between the beds or the cradles should be adequate. There is always, you have to maintain 1:1. In a NICU, I'm taking 1:1
Ratio.
NICU for the
Yes.
level 3. Sister is to patient ratio. Then again, you have to strict, you have to set a rule, so that the parents or the attendants wouldn't come with the mobiles and all. They should have a
Yes.
typical gown. They should have a typical scrub to enter inside the
Yes.
premises. They shouldn't touch anything like any incubators or any warmers, any instrument they shouldn't touch. So we have to make a checklist, a protocol, proper protocol, so that should be ticked when an attendant is visiting a baby.
Yes. So now, Aditya only can say that what kind of corrections do you get if at all you have served witnesses you that you have not done the hand rub? Because I've seen many of our, many of the in many setups, neonatologists and pediatricians are very strict because yeah, they are responsible because these babies are with a lot of low immunity. So what kind of corrections do you get, or what kind of training you get from Sir Aditya? Can we hear?
Actually, while we entering the NICU, first we will keep the gown and everything, and we will go
Yes.
and we will do first a hand wash. The
Yes,
proper
yes.
hand wash with the 7 steps we will do. And
And
after
then you're
that,
allowed.
yeah, and after that only we will touch the baby.
Yes,
Even,
these are the
yeah,
very core fundamentals of preventing the hospital acquired infection or cross contamination. And I
Yes,
think
ma'am.
NICU, PICU, they should adhere to this strict protocol. Yes.
Yes,
even
Having
ma'am.
said so, I think yes, we have come to the end of the session, and thank you, sir, for your valuable update. And
Thank you very
thank you
much.
all the speakers. And this is very time-bound session, but we urge all the viewers to just refer to our website for more health academics update and short reels, and that's how we learn. And yes, we end the session. Thank you, everyone.
thank you.
Thank you everyone.
Thank you, sir.